Hey everybody, and welcome to Studio 64. My name's David, and I've been searching the interzones for some more science, space, and tech news to share with you. And I found this over at RT.com. Yes, Musk's brain chip to be implanted in second patient, according to the Wall Street Journal. Yes, Neuralink is planning to extend the trial to 10 people this year, allowing them to interact with a computer using their thoughts. Yes, bring on the cyborgs. Good old Philip K. Dick, the sci-fi writer, was right. Absolutely incredible, isn't it? But we're basically cyborgs now. We've got our phones attached to our bloody nailed to our hands every day. But still, this is the next step, and it's very interesting. My personal belief is like all technology, it's not inherently evil itself. It's what it's used for. Very, very interesting indeed. And of course, we can see it has some good things, like people who are paralyzed and all that sort of thing. But it could also be used for nefarious purposes. But that doesn't mean we shouldn't stop developing the technology. The US health regulator has granted permission to Elon Musk's Neuralink to implant a brain chip in a second patient, despite some initial issues with the first test subject, the Wall Street Journal reported on Monday. And for everybody jumping up and down about this and saying, oh, it's terrible, 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 like I said, what happened with the first heart transplant with Christian Barnard in, what was it, 1967 or 68? Oh, no, you can't be doing that. You can't be doing that. Heart transplants done all the time. Interesting. And there's a South African you can't complain about. Funny enough, it's another white South African, Dr. Christian Barnard. Yeah, interesting. Now we have another white South African doing something similar, and everyone's jumping up and down again. Fascinating. Give it a few years, and people will see that Elon Musk had the right intentions at heart, if you'll pardon the pun. Now, the brain chip startup received approval from the Food and Drug Administration, or the FDA, to conduct a trial with a second patient using a modified procedure after the company proposed to fix a problem that occurred with its first test subject, the outlet said. Now, the chip, which is named telepathy, was successfully implanted for the first time last February. It allowed 30-year-old quadriplegic Nolan Arbau to control a computer mouse using his thoughts with no ill effects, according to the neurotechnology company. Now, the surgery involved a specifically designed robot placing the computer chip, which is about the size of a coin, with ultra-thin flexible threads in the region of the brain that controls the intention to move, Neuralink explained. The chip was then used to record and transmit brain signals wirelessly to an app that decodes movement intention. Now, earlier this month, Neuralink said tiny wires implanted in the brain of its first patient had been pulled out of position. Last week, Reuters reported that the company had known from animal testing that the wires, which are thinner than a strand of human hair, could retract, along with the electrodes used to read brain signals. Again, early days, you're going to have some bugs, right? I know this is to do with computer people and lives and whatever, but again, I keep going back to the first heart transplant with Dr. Christian Barnard in the late 60s. Everyone thought he was a raving lunatic as well, and it was evil and immoral and everything else. And now, if people have heart disease, we've got to get a heart transplant. It's just give it, it's just a new thing, and it's a shock to everyone's system and a culture shock, whatever it's called. But eventually, people are going to accept this kind of thing. Unfortunately, the other thing that we can't avoid, unfortunately, is the fact that some people will want to do some horrible things with it, which I think is terrible. But it's going to be good, I think, for mankind as we progress. Now, with the second patient, the quarter-sized chip will be implanted deeper into the brain to prevent it from retracting, according to the WSJ, good old Wall Street Journal. Neuralink expects to implant its device in the second patient in June, and another 8 people will participate in further trials before the end of the year, the report said. More than 1,000 quadriplegics have signed up for its patient registry. Now, the startup has claimed that the ultimate goal of the project, dubbed the Prime Study, is to develop a fully implantable wireless brain-computer interface that would give people the ability to control a computer cursor or keyboard using their thoughts alone. This would make way for the groundbreaking treatments for people suffering from physical disabilities such as paralysis and blindness, as well as illnesses like obesity, autism, depression, and schizophrenia. This is absolutely amazing. My opinion is good. Keep going. I noticed that a lot of people who are critical of Elon Musk for this sort of technology are ones that openly embrace heart transplants and stuff like that. I found that quite entertaining. Made me smile when I'm going, it's just the next step in medical technology evolution. Yes, we are becoming a cyborg, but then again, you know, you look at what happens with heart transplants. Before they were actually human hearts, they were pigs, they were pig hearts or whatever. Now, very, very soon, we're going to have electronic hearts. Are you going to complain about those? No, of course not. Again, it's just because it's new and it's scary. That's all it is. But as I keep saying, eventually this will become the norm. Give it a generation or two. Absolutely fascinating. Love to hear your thoughts. Let me know what you think down in the comments. All right, well, my name is David. Thanks for joining me for another Studio 64 Science, Space and Tech News update. I shall see you in the next one. If you enjoyed this video, please like, share, subscribe. I'd greatly appreciate it. If you're up for it, drop a comment down below the video because I'd love to hear what you think. All right, take care. And as I always say, if you can't be good at it. And as I also always say,
my brain hurts!